Good morning to all. As we continue with the medical term that we discussed yesterday, that is the platelets. So, these cellular fragments, tiny cells with many glycoproteins, as mentioned yesterday, it is involved or it is one of the steps of hemostasis, that is, stopping the excess blood flow. So, along with the vascular constriction, followed by platelet plug formation. And there comes the third step, the blood clotting. So, this platelet plug gathering is initiated by the actin and the myosin, which keeps contracting and making the platelet plug compact. So, what happens next? So, when a vessel is damaged or when the collagen is exposed, we do have a lot of clotting proteins, a lot of clotting factors produced by our liver, but they produce them and remain as inactive stage. But only when there's an injury, this inactive blood clotting factor becomes active. So the first factor that gets activated is factor 12, also called as Hagman factor, which in turn activates factor 11. And with the help of calcium and other factors like factor 4, it goes on to activate factor 9. Continues with factor 8 and other platelet activating factors, which finally activates the factor 10. Once the factor 10 is activated, which is done by the tissue thromboplastin, which is also called as factor 3, again the calcium ions and platelet factors and factor 5, along with factor 7, converts your prothrombin to thrombin. So the main stage protein is the thrombin, which in turn converts your fibrinogen to fibrin. So fibrin is the main component which stabilizes the injured area, which triggers the entrapment of the blood cells, and thereby the blood clot is formed. So yesterday, it was more towards the hemostasis, and today we complete that process, not only referring to the platelets' involvement, but initiated by the vascular spasm and ends up with the blood clot, which is aggregated with blood cells and fibrin.